Joining us from. My name is Therese Brown, and I'm a research analyst here at Canada Health Infoway on the performance team. So thank you all for joining our webinar today. We will be discussing the integration of AI in healthcare. Please be aware that this webinar is being recorded, and the recording, along with the full presentation slide deck, will be posted to our Infoway Insights website at the conclusion of the webinar. So before getting started, I would like to complete our land acknowledgement. So we acknowledge that the lands on which we gather for this event are the traditional territories of many Indigenous nations. Canada Health Infoway recognizes the profound and ongoing injustices experienced by the Indigenous people, what we now call Canada, which continues to impact their health and well-being. We honor the resilience and strength of Indigenous communities and their rich cultural heritage, which contributes to our understanding of improved health outcomes. I invite all attendees to reflect on the territories from which they join us. Let us commit ourselves to deepening our understanding, fostering genuine connections, and actively contributing to reconciliation efforts. Together, may we strive to create a future of respect, understanding, and partnership with Indigenous peoples. So we have a great agenda lined up for you all today. So following my short introduction remarks, we will have 4 presentations lined up. The first will be discussing upcoming trends and the impact of AI moving into the healthcare space. Following that, we will reflect on how AI can be used as a tool to accelerate the Pan-Canadian Interoperability Roadmap. Next, we will hear from a nurse's perspectives on the perceived barriers and facilitators to AI in nursing practice. And to finish off, we will present the current state of AI use in Canadian healthcare based on evidence from Infoway's landscape surveys. As usual, we will save Q&A for all presentations until the end. Participants can feel free to send any questions they have through the Q&A feature in Zoom throughout the webinar, and these will be moderated and answered at the end. So, jumping into our first agenda items of welcomes and introductions. A big welcome to all new and returning attendees that have joined today. Briefly, for new attendees, these webinars connect jurisdictional leaders, evaluators, and researchers to share best practices, results, and other insights focused on evaluation in digital health. If you're not already on our distribution list, I invite you to get on our mailing list so you can stay up to date with all our events and webinar announcements. So to introduce our first presenter, we have Dr. Julia Zarb. Dr. Zarb is the founder and CEO of Blue by Blue, a company focused on empowering as well as supporting leaders and teams in integrating and aligning AI with their strategic goals. When you are ready, Dr. Zarb, the floor is yours.
Thank you so much. Welcome to everybody, and thank you, Therese, MHI grad. Cheers. First, I want to talk a little bit about the breadth of this topic. You know, what is AI and what is AI in healthcare? It's quite apparent, I think, to everyone that that question is not something that will be answered in 10 minutes. But I think the question that we really should be looking at is this really a question that we need to answer specifically? Let's unpack that a little bit. What we really need to look at is what is the impact of AI in healthcare. And we can easily say that AI is becoming more pervasive. You look at post-pandemic and over the last year, we're seeing a lot more use and usefulness in terms of AI used for everything from diagnostics, improving patient communication, using AI to help people in rural and remote areas actually connect into greater systems. So, in some ways, what we're seeing is that AI is a continuation of what we've been trying to do in digital health, actually, for quite a few years in terms of our purpose. Um, AI right now internationally is something that I think is really topical, and I don't want to let today's opportunity to chat go by without looking at us maybe in a global context. So, the what of AI is perhaps something that we'll go through and is perhaps secondary to the why of AI. And the why is really the same criteria that we've been using in healthcare, digital health, health IT for 25 years. And that is it used and is it useful? So really we're trying to see, do we have in AI new innovation that is used and useful, that is reflecting who we are or reflecting who we want to be? And in order for us to understand those two elements around AI in healthcare, we have to come really right down to the very heart of the matter in the most simple way. And thank you very much to my friend Howard Rosen, who is likes to bottom line very well. The very, very basic question is, who do we trust? Um, in healthcare AI right now, we have an interesting paradox. The general public in Canada and elsewhere is actually hopeful. There are a lot of people who say that they can see that AI will improve in different areas of patient care, patient communications, coordination of care, et cetera. And also in terms of clinical operational efficiencies. It's no secret to any of us that the health system is burdened by wait times and, despite best efforts, inefficiency. So I think there's a lot of hope. Where the paradox is really is that there's not as much concern about privacy as you would actually think, because the idea is that I think, by and large, we tend to trust in the system at the macro, meso, and micro levels. So we do see that the trust element for people who are working in healthcare and in AI is something that is uh, pervasive, but it is generally addressed by governance. So the way that we govern AI is actually the way that we reflect what we trust and who we trust. So governance tends to take into account everything from responsible AI, sustainability, to ethics, to privacy, to security, even interoperability. And we have to look at who is it and what is it that we are going to put our confidence in a sense, in order to move forward in AI. What I've prepared today is really just a look at Canada, US, and EU in terms of governance, and who we trust and how our trust is really manifesting, I would say, in healthcare, and how that will actually lead to the outcome of more AI per the vision of what I would say would be the not just the proponents of AI, but those across the system who actually see the hope and can measure it against the hype, which is remarkable. By and large, what we're seeing in the research is that people are moving more from fear into FOMO. Um, and that FOMO means that in some ways, particularly with generative AI, and in the use of AI without governance at times, um, good intentions can bring through bad results. Procurement patterns are, jumping the guardrails. We're not entirely looking at systems across the board in Canada, EU, and US that are observing guardrails that are similar to the ones that have been put in place over the last few decades for health IT. So let's look at, for example, in pardon me, I'm going to go to my next slide here. Um, if you look at the elements where, as cultures and societies, we allow and enable the use and usefulness of AI in healthcare, you see that there's a common thread of looking towards regulatory frameworks, data management, looking at where the drivers are, what can we be enabling with and through those drivers, where the challenges are, and what directions we see. So coming back, we see that in Canada, we tend to look very much at the hope represented through elements such as personalized medicine, operational efficiency, and we do take a lot of stock in AI-driven research. We do have uh, several trust issues, I would say, that are coming home in some of the privacy regulations and in the overall governance regulations around data. This is a really interesting counterpoint to what's going on in EU right now, where there is a push and pull really on strict oversight of data and regulation, and in the US, where we have federal AI policy that is incredibly fragmented. I have the opportunity right now, uh, currently, to be working on the US AI policy principles and guidelines from HIMSS, which is a large trade organization, and where I just won a Changemaker Award that I'm very proud of, based on what's called policy influence over the times. And really, that just means advocacy for the voice of healthcare and clinicians and the system safety, privacy, ethics, security, interoperability, being seen through the lens of policy and played out through the federal and state levels. Um, with the current administration in the US, what we're seeing is a real disruption of structures and infrastructures that have been in place. There's a lot of concern, I think, that this paves the way for not just competition, which is healthy, but for an imbalance in competition. So the trend that we see there is very large organizations creating statements and lobbying towards relaxation of regulations. In Canada, we have many more checks and balances, though um, we do have some challenges in, like as with the EU and US, in converting what happened in the pandemic and the rules that were relaxed, um, in a sense, in order to expedite and enable more access to care virtually. These conversions are not necessarily being seen as being baked into laws across the board. So for the US, this means that we're ending up with a lot of loose ends, really, in what would have been the infrastructure and regulatory and policy frameworks. In Canada, we're fighting a lot of battles, I would say, at provincial and federal levels that have some sort of ripple effect on AI. And in EU, I think there is a accord, but there's also a great level um, of disagreement on the core topics. And once again, that topic tends to be trust, who's in charge, who do we trust? Who do we trust to be in charge? What do we trust to convey the principles and embody them? What are those principles? And also, I would say we need to look at a huge trend towards where our liabilities accruing. So this is sort of a high level view. The trends in general are a great rise in hope, and in general, a greater complexity of regulatory and policy guardrails being both introduced and sometimes getting a bit tangled up. So thank you, Therese. I know we have a lot of detail to go into today, and I appreciate having the opportunity to give a really big picture on what's happening in the world around health AI and for context.
Great. Thanks, Dr. Zarb. Fantastic thoughts and content. Just a reminder to everybody, we love to see the participation and questions in the chat, but please submit questions to the Q&A feature. These will be answered at the end. So on to our next presenter, we have Attila Farkas. Attila is InfoWay's digital health AI strategy expert. In his role, he focuses on developing InfoWay's digital health AI strategy and framework. So when you're ready, Attila, the floor is yours.
Thank you so much. Hope you can hear me well. So very glad to be here today. When we heard about this webinar, we were very excited to be part of the lineup. I have to say 10 minutes will not do justice explaining how we can accelerate the shared interoperability roadmap. But I tried to do my best with a couple of slides to give you a hint and a flavor as to where we see the opportunity and where we believe that the two things are very much helping each other. So if I am to ask or to leave you with three takeaways, what I would like you to remember from today's presentation for my slide deck is that AI and interoperability are not mutually exclusive. It's not an either or. The two are basically connected at the hip. That data is an absolute essential ingredient for successful AI, and that we will require proper trust elements in place in order to access data predictably, safely, and at whole scale. So I would like to focus on the acceleration of the roadmap, keeping these three things in mind. By way of reminder, some of you hopefully have had a chance to read the Shared Interoperability Roadmap. InfoWay worked in collaboration with the FPTs in Canada to develop an interoperability roadmap 3 years ago, and it's been going through great advancements, big progress. As you can see on this slide, we had 4 strategic areas where we wanted to focus efforts for improving interoperability. But ultimately, the reason we were trying to do that is so that we create a connected care system with patient in the center of care, and data is shared in such a way that it helps clinical specialties, providers, to care for the patient at the best of their ability. The data should be just in time, at the right place, at the right time. So that was the idea behind the roadmap. Now, when we look at these priorities, these are not so different from the current hype that AI is going through. And I wanted to emphasize a couple of areas of AI, because we have a tendency to talk about AI as if it was one single thing, whereas we're using the artificial intelligence concept very loosely. And there's a variety of capabilities in different domains that are going to be more or less effective in certain areas and less effective in other areas. But we have seen an explosion of interest in AI, without a doubt. We have seen recent advancements in ambient scribe capabilities. That goes back to one of the priority areas of the roadmap, which was primary care physician help with access to data, to the longitudinal patient record, to keeping records, to record keeping, to collecting information about the patient. There's fantastic opportunities there, even though at this point we're looking at the biggest opportunity if you start chaining these models. AI Scribe is notorious for converting a spoken speech into text, but then you cannot stop at text. You have to codify the text. You have to store it in context. Then you have large language models and their retrieval augmentation components, where you could potentially use that to process even legacy data. You have machine learning, agentic AI that carries big promise. And then who can forget about the generative AI, where the data that is trained on can be very useful if we're getting it right. So I want to talk a little bit about this interconnection between AI and interoperability. when the hype about AI started coming into our everyday life, there, I noticed some level of tendency where people were saying, we no longer need standards. We no longer need interoperability. AI is going to fix all this. In reality, those that understand AI and the technology folks and the guys that are sitting behind the desk developing the models behind it, the algorithms, understand that AI is basically a black box that is very smart, but it's going to be as smart as the data that you enter, and it will give you the output that you expect if the data that you entered is reliable. So getting to the data, understanding the data is absolutely about interoperability between systems that have collected this data, that have put it together. And so I wanted to highlight the fact that these are not separate discussions. Interoperability has an opportunity to bring data to AI engines, and AI has an opportunity to even process legacy data so that it modernizes it. But ultimately, what you want to have is you want to have predictable data that's properly understood. I'm going to talk a little bit later about this. One item that I wanted to emphasize from the roadmap, because it makes sense from the perspective of how do we accelerate the roadmap, I wanted to highlight the data and the trust components. Those two components are part of the building blocks that we defined in the roadmap. And for those that are familiar with the data framework, for example, syntactic and semantic interoperability comes to mind. So let's talk a little bit about that. Using data that is ambiguous or it's not semantically properly defined will give you results that are less than ideal. The worst case that you can have is to see plausible data that is incorrect. This will throw off decision support systems. It will give you potentially erroneous data. So we have to recognize that advancements in data standardization are to the benefit of AI. And AI, through some of their models, can absolutely help improve predictability in how do we deal with legacy data, because we're sitting on mountains of information, and you cannot expect that the industry is going to throw all that out and introduce new things. In the process, we have an opportunity to improve the data that we have and to collect the data better. Which brings me to the next point, the ethical and privacy-focused access to data. When we're talking about trust environment, trust is not a feeling. Trust is a technical environment in which you have predictable access and you know who you're sharing data with, who should be able to access it, and how do you put that data together to good use. So while AI is flourishing, we need to make sure that everything that we do from the roadmap in terms of trust and exchange, data exchange, supports AI, and that AI abides by those rules. Finally, I wanted to leave you with a little bit of sort of a teaser. InfoA is in the process of developing an adoption framework initiative where we're trying to see what are the best components that we would want to promote that would help with robust adoption of AI in the Canadian landscape. We want to make sure that when you're looking at assessment, evaluating, or classifying AI solutions, you're not using the same lens for every single opportunity. You're using the right lens for the right opportunity. You're aware of rules, regulations, risks with what you're going to choose. We're trying to help decision-making adopters on reducing risk and increasing, accelerating, basically, adoption of these solutions where and when appropriate. So with that, I will turn back the mic to our other panelists, and hopefully we're going to have a chance to have a little bit of a chit chat or question and answer at the end. Thank you.
Perfect. Thanks so much, Attila. Great presentation. So next presenter up is Dominique Boston. Dominique is one of InfoWay's nursing champions, and she continues to work at the Hospital for Sick Children, where she has filled various roles, nursing roles over the past 6 years. So Dominique, when you're ready, feel free to get started on your presentation.
Thank you so much, Terrence, and thank you, Julia and Attila, for those insightful presentations. So as mentioned, I will now be bringing forth more of a nursing perspective when it comes to artificial intelligence in healthcare. So this is just a brief agenda for my presentation. So really just looking at Why is it important to include nurses in the conversation surrounding AI, some of the benefits it can bring to nursing, and then some key pieces to consider when it comes to the development, integration, and adoption of AI within nursing. So just a brief background, as Terrence mentioned, I am a registered nurse. I spent most of my time in acute care, and I was able to work in ambulatory care, where I supported multiple specialty surgical clinics. I'm currently completing my Master's of Nursing and my Primary Healthcare Nurse Practitioner certificate, and I'm working as one of the nursing champions with Canada Health Infoway. So why nursing? Why is it important to include nurses in the conversation around AI? Well, I thought I'd bring forward a few stats to help paint that picture of our Canadian healthcare. So these numbers are brought forth by CIHI, which is the Canadian Institute for Health Information. And what they do is they look at the state of the health workforce in Canada. And this is one of their more recent reports that was completed in 2023. And I just wanted to mention that nursing is sort of an umbrella term, and it often encompasses different classes of registration. So as you can see here, we've got some data on registered nurses, licensed practical nurses, and also known as registered practical nurses, our psychiatric nurses, and then those nurse practitioners, which have an advanced scope of practice as they are able to care for patients more independently. And so altogether, they bring a total number of 477,000 healthcare workers. And when looking at physicians in Canada, their number adds up to 97,000. So, it's quite a bit difference. And it's just to bring to people's attention that we are the largest group of regulated health professionals, and that in Canada, we actually account for about half the healthcare workforce. So circling back to that question, why nurses? Why include them in the conversation around artificial intelligence? Well, we are a huge part of our healthcare in Canada and are prominent across various settings. And so when it comes to things like change and innovation, nurses really have to be considered right from the beginning in all conversations. This is just a quick slide for those of you who maybe aren't in healthcare or are not familiar with nurses' work settings, but majority of them do work in a hospital setting. However, some work in community settings, so that's more of like that primary care setting. So things like public health, nursing clinics, home care. They work in long-term cares. I feel like that's quite well known. And then other employment settings include areas such as research, academia, maybe with nursing organizations or government organizations. And the key takeaway from this slide is really that actually over 30% do work outside of hospital settings. And this is just a quick slide to bring to your attention that, it has been a difficult time for nursing, and it still remains that way. There is a national nursing shortage. So another report by CIHI confirmed that there was a shortage of 60,000 nurses in 2022. And that happened to be right after a pandemic, which, as we know, really affected healthcare, and that included nurses. However, it doesn't stop there. The shortage is anticipated to grow to well over 100,000 by 2030. So these challenges still remain, and nurses continue to face them, and these include working short staff, so completing the same task, but with less support, which is leading to increased workloads. And some other things to consider is that we've got, growing populations, so our hospitals are busier, and we're able to manage more chronic, complex conditions, which also leads to increased workloads. And this leads to overtime and high rates of burnout. And I felt it myself, and I see it amongst my colleagues. The quote down below is by the former CNA president, and he talked about retention and sort of thinking of retention beyond just how can we add nurses to the workforce, but how can we support them? How can we increase their productivity without increasing that burnout and running them to the ground? So this is where AI can come and support nurses. And when we support nurses, ultimately the care provided improves. And we see that as an impact on positive health outcomes. So some of the direct nursing care benefits AI can bring forth is things such as reducing any sort of administrative burden. So a big one right now is the AI scribes. So looking at that AI-powered speech recognition, but even things such as filling out patient forms, or maybe a patient's leaving the hospital and they require instructions instead of the nurses typing it out. AI could have that ability to auto-generate those. It can also detect subtle changes in patients' health status and prompt an earlier intervention. And this might seem obvious, and it is integrated within our role. However, when we're caring for, 5, 6, sometimes 7 patients, and who knows, maybe it's the middle of the night and there's less support around, sometimes these subtle changes can be difficult to identify. So AI can support nurses and help prompt them in those early identifications. So things such as maybe the vital signs machine is picking up, some subtle changes in those numbers, and that it's looking like that condition might start to deteriorate and it's not looking in the direction we want to look. Well, AI can prompt nurses and say, hey, you might want an earlier intervention. And then lastly, it can help with increased education and support for their patients. And there's 2 factors to this. The first one being if they're spending less time on administrative tasks, then they have more time to provide patient-facing direct care. But then also they're able to generate those summaries and educations that are specific for patients to be able to take home. And then to the right, on an organizational level, well, it can help enhance our training, so providing some clinical scenarios for us to run through. It can look at optimizing staffing levels, so thinking about, on the predicted patient volumes for the upcoming week. The current staffing we have might not meet those demands. So how can AI sort of analyze the current staffing ratios to patient ratios, and looking at things like, this patient's scheduled in for a bit more of an intensive surgery and they might have to stay longer and we don't have enough nurses scheduled or staffed for the upcoming shifts. So how can we make some adjustments and properly manage those resources across the hospital? And then when it comes to the actual integration of AI, there's a few things to consider. A big one is that just because something is innovative doesn't mean that it will be adopted. The adoption really depends on the needs it's meeting and then the community's values and interests. So it's really important to have a sound understanding of clinical workflows. So looking at what is the current process, what can be improved, and who are those key players. I often see it where something new is implemented within healthcare, and it's looking at just that one encounter, just that one provider, and doesn't look at the solution from start to end. So things such as our administrative assistants, or maybe our nurses and physicians, how are they working together to care for our patients? Another point to consider is that, as we are managing for more complex and chronic conditions, there's been a shift from a physician focus to multidisciplinary care to be able to meet the needs of the patients. So when it comes to integration or adoption, it's really important to look at all those key players, and that includes nurses, but also other allied health professionals. How are they working together to provide care for the patient, and how could this new system or this new technology that has the AI capabilities really benefit? Because once you include everyone, you're reaching its full potential and ultimately patients benefit. Attila did a great job at touching upon the interoperability between systems, and just from a nursing perspective, how is this new technology going to implement with my current workflow? Will I have my patient's information available, or will I have to go look for it elsewhere? These are some things to consider, because every extra, login, every extra task, or every extra little step that defers nurses further and further away from actually utilizing the system to its full potential. And then lastly, the point below is, it's really key to involve a broad level of leadership and to have some good go-live support. As a nurse, it's difficult to take time out of my 12-hour shift to be able to complete some training. But if there is that leadership that's involved, they will make it a priority and dedicate some time for nurses to get a better understanding and get comfortable with the system. And once something is new and integrated into healthcare, how are we going to support nurses? Every day there's a new challenge, a new clinical scenario that we're facing, and we're not always the most tech savvy. So how will there be support there available? And typically requires, more prompt support in the early days, and then it can fade off. So these are some important areas to consider. And then I'll just touch upon this quickly because Waldo will be presenting this in further detail after me. But in 2023, Canada Health InfoWay conducted a survey of nurses and had a section on some key AI insights. And I just wanted to bring your attention to the right side, which is the number 70% of nurses do not feel knowledgeable about what AI is. And that is quite a big number. It's possible that since there's been a lot of buzz with AI lately, and especially AI Scribe, as I mentioned before, that percentage may have decreased, but it's still quite high. So it's important to remember that this is new to nursing, and not a lot of nurses have received training or have guidance on how to use it in their clinical practice. So if they're going to be adopting it, they must be able to trust it. And so on that note, as AI continues to emerge and integrate within healthcare, it's critical to involve nurses right from the beginning and a part of those critical conversations. And I'm hopeful that we'll be able to drop the 70% to 0% in the near future.
Thank you, Dominique. Great presentation. It's always wonderful to hear from frontline clinicians about new technologies and their perspectives on it. Okay, so on to our final presenter now. We have InfoWay's Waldo Beauséjour. Waldo is a senior research specialist on InfoWay's performance team, and here he will be discussing the current state of AI in Canadian healthcare as per InfoWay's landscape survey results. Go ahead, Waldo, when you are ready.
Okay, thank you, Therese. Before I get started, let me just make sure that everything is correct. Okay, thank you. Hi, everyone. Thanks for joining today's webinar. My name is Waldo Beauséjour. I'm a senior research specialist at InfoWay. You've heard the perspectives of my fellow panelists. Now, what about you? Either you are a patient or a clinician. What have you told us about your perceptions of AI in healthcare through our surveys? So my presentation is going to be we'll focus on AI-related findings from InfoWay's landscape studies. It will revolve around a brief description of these studies, then explains the approach used for data collection, and we'll dive right into the key findings related to AI. Our landscape surveys are national surveys conducted on healthcare providers and Canadians. They collect a variety of topics. For Canadians, for instance, we collect information about digital health uptake, digital health literacy, connected care and care coordination, electronic access to their PHI, their personal health information, virtual care services, and we collect information about AI. So we don't have specific AI surveys. We have digital health surveys within which we ask AI-related questions. Now, for AI in particular, for Canadians, we investigated a variety, or we collected a variety of topics. Canadians' knowledge of AI, their comfort with AI use in healthcare as a tool, and their comfort with the use of their PHI for AI research, and finally, their concerns with AI use in healthcare. Now, on the clinician side, we collect data on a variety of topics: EMR adoption, use of digital health solutions, electronic prescribing, interoperability or health data interoperability, barriers to digital health use, and finally, AI use in practice. So the same way we collect information related to AI from our citizen-based surveys, we also collect information or AI-related indicators from our clinician surveys. And for AI in particular, what we do for the physicians or for the clinicians, to be more specific, we collect information about their knowledge of AI, their comfort with AI use in practice, and most importantly, their perceived benefits and perceived problems with AI. Now, for the surveys, we borrowed our own definition of AI because since we are going to collect information about AI, we need to operationalize the concept. And the definition that we use is the following. AI, or artificial intelligence, refers to any current or future machine learning approach to predictive analytics, decision support systems, and or automated decision making. Very simplistic. And again, this is coming from our toolkit for implementers of AI in healthcare. You can check it out on our website. Now, in terms of survey methodology, for most of our surveys, we use research quantitative approach, whereby we design a survey questionnaire with our partners or collaborators. We hire we hire a market research firm to implement the survey. We've been working with Leger. We use the market research firm's online panel for citizen-based surveys and membership list from clinical associations for clinician surveys. For example, for the nurses survey or nurses surveys, we've been working with the Canadian Nursing Association, the CNA. We worked with the CNIA, the Canadian Nursing Informatics Association, and for the physician survey, we worked with the CMA, the Canadian Medical Association. So we select non-probabilistic samples from those online panels and membership list, and we distribute the surveys online. And lastly, we weight the survey results using StatCan census data, CHI workforce data, and other relevant sources. This is to give you just a flavor of the sample size we achieved for our surveys. For example, for the citizen-based survey in 2023, we achieved a sample size of 10,000 Canadians, 10,000 and plus. For nurses in 2023, it was 1,900 and plus. For the physicians, 2024 last year, we achieved a total sample size of 1,100 and plus physicians across Canada. Now let's dive right into the findings, starting with the Canadians or citizen-based surveys. Less than half of Canadians feel knowledgeable about AI, and the overwhelming majority believe public investments in AI is crucial for a competitive Canadian healthcare system. Roughly 50% of Canadians are comfortable with AI as a healthcare tool, but 58% support using their personal data for AI research with patient consent. For other users, one important result is over 70% of Canadians are comfortable with AI as long as it optimizes workflow in healthcare settings to save time for healthcare workers, therefore efficiency. I want you to save this stat at the back of your mind for now because we'll get back to it later. 60% of Canadians ranked loss of human interaction with healthcare providers as top 3 concerns with AI, whereas 47% ranked privacy breaches among the top 3 concerns. Now, moving on to the clinicians, starting with the nurses, only 6% of nurses are aware of AI use in their care settings. Dominic mentioned that earlier, and it is being used for a variety of reasons, including clinical decision support, medication management, and predictive analytics, just to name a few. And we have 30% of nurses feel knowledgeable about AI, which I think is an important stat for our nursing educators. And 38% of nurses are comfortable with AI use in healthcare. Now, top 3 benefits reported by over half of nurses: significant future impact of AI, reduce admin tasks, which I think aligns perfectly with findings from a recent study in Ontario that reported a reduction in admin burden due to the use of AI scribe solution, and improved care planning as the top 3 benefits reported by the majority of the nurses. Now, top 3 problems, because we know AI is not perfect. Let's agree on that. Now, we do have some problems reported by the nurses. Top 3 problems reported by over 3/4 of nurses: loss of human interaction. I think this one is a bit can be debated because I discuss it with some nurses, and some think the opposite. They think since AI will free up time for them, they will spend more time with patients. Potentially, this this could improve or increase interaction with their patients. Data security and privacy concerns. That's another problem reported by nurses. And lastly, as the top three, medical liability issues. Now, moving on to the priority for the nurses. And when we look at the stats, everything seems to be a priority. But when it comes to the high perceived priority to support AI use in nursing practice, the top three reported by over 70% of nurses remain training and education, regulation and accreditation, clear policies and guidelines. So this one I think should be taken seriously with our policy people. And then moving on to the physicians. For the physicians, what we collected was 7% of physicians said they use AI, machine learning in their main practice setting to support patient care, up from 2% in 2021. Remember, 2021, we were still in COVID-19. And then in terms of perceived priority, the top three that made, or the three that made the top of the list were regulation and accreditation, training and education, similar to what we saw earlier for the nurses, and then physician leadership to guide appropriate use of AI, which is not too different from what we collected for the nurses in terms of priority. Now, what should we learn from all of this? Patients and clinicians, they both value AI for its efficiency benefit. We saw that the 70% that I mentioned earlier that I asked you to save. So 70% of patients said they are comfortable with AI as long as it improves efficiency for clinicians. So patients and clinicians, they both value AI for its efficiency benefit. Now, on the clinician side, clinicians want comprehensive AI training and robust regulation. Where do we go from there? Thank you for your attention. So back to you, Therese.
Thank you, Waldo. Great presentation, as always. So we have just over 10 minutes left here. We're going to leave this time open for questions. So as previously shared, please submit all questions in the Q&A feature. We're going to be starting with the questions that have been submitted there, and then if we have time left, we'll move on to what has been submitted in the chat. So the first question we have through the Q&A feature for the panelist is there a space for PSWs in AI?
I'm happy to address that. I would say yes, definitely. They're providing patient care and similar to other healthcare professionals, automating those tasks and supporting their role. There's definitely room for them.
Fantastic. So on to the next question. How can Canada's health regulations ensure AI-driven interoperability while maintaining data privacy and security across provincial systems?
That's a tough one, isn't it? I'm not surprised that it's being asked because it's one of the biggest challenges, quite frankly, as I was talking in my presentation about data and access to it. It's also the reason why I'm saying that we shouldn't look at AI differently from the interoperability efforts that we have been doing over the past few years. It is very well recognized that access to data needs to be facilitated. The barriers need to be brought down. Some of you may be aware that the federal government was talking about Bill C-72 recently. Unfortunately, now they're in caretaker mode, so none of that legislation will come forward yet. But the fact that it has been broadly socialized with the industry, we have heard very positive feedback from the industry collaborative vendors that are collaborating with Infoway. that everybody agrees that things need to change and that data will be liberated in a privacy abiding way so that you can express what data you want to make available to capabilities that are emerging. So these two go hand in glove. Jurisdictional partners are all aware of this. They're working together. We're convening the industry and the provincial and federal government to find solutions to these things. And it's understood that it is an ingredient for successful AI.
Thank you, Attila. Anyone have anything to add there? Okay, we'll move on to the next question. So what evidence is there that AI will result in nurses spending more time with patients? 40 years of efficiency-oriented initiatives have not resulted in this, so why will AI produce this result? And this is a question open to all panelists.
I'm happy to start. No, that's a great question, and it is new, and it's not new, but when it comes to nursing, it hasn't widely been adopted. I think Waldo's percentage was 6% of nurses have been using it, so we will continue to learn as it's integrated. But I don't know if people know the saying, like, if you didn't document it, it didn't happen. So we're documenting everything from like the circulation in your toes to maybe the blood on your dressing. So every little detail, has some sort of administrative aspect to it. So if we're able to reduce that administrative load, it can take away from our time spent at a computer and allow us to spend more time with our patients.
And Teresa, I want to perhaps add here as well that it's such a very good question. So years ago, and I've been working for a couple of decades, at least in this field, we had this sort of almost false dichotomy that we created, which was spend time with patients or spend time on the tech. And this is sort of an extension of that question. So really, and I think Dominique's answer points to this, as AI sort of sinks in more and becomes more used and useful all the way along the way in the system, what will happen is that people's roles and what they are really training for in their roles will become they will have more time available to them. But I have learned when I was on the marketing side in the early years that telling clinicians what to do with their time doesn't always go very well. So I think it may be what we're seeing is a little bit of a different workflow opening, and that will convert also to patient flow opening, meaning that these efficiencies are going to be in some ways iterative across the system. Right now, we see that an inefficiency in one place is sort of like whack-a-mole, right? It pops, you control it in one place and it pops up in another because utilization management, patient flow, et cetera, doesn't work such that fixing one thing means that, it just it changes everything for ever and down the line. So I think there's a real systemic answer to that.
Yeah, if I may, Therese, if I may add to the discussion, let's agree that AI is not the magic pill that will solve the efficiency problem that we've seen in the Canadian healthcare system. Let's agree on that. But at the same time, let's put some numbers on the things. Based on the study that I mentioned earlier, the Ontario study around AI scribe solution, it was reported that primary care providers, they collectively spend 18.5 million hours on admin tasks, time that could otherwise be used for 55.6 million patient visits. So just imagine these numbers. They are huge numbers. Now, the promise of AI, when we say AI, let's be more specific. AI Scribe is to reduce this time and bring more time back to the physicians or the clinicians so they can spend more time with their patients. So that's the thing. So I don't think it's gonna solve the problem, but we do get some benefit or some benefits from AI and AI scribe in particular. I know for AI scribe solution adoption is pretty low, 5% in Canada for now, but we expect it will increase, especially since Infoway has launched its program, AI scribe program. So that's what I wanted to add to the discussion.
And if I may briefly just carry that point, I think that one thing to build on what Waldo is saying, in fact, is that right now we look at AI in general as doing what we do now as bigger, better, faster, stronger. And we tend to look at it as very operationally and task oriented. However, I do think there is a big space for clinicians, and this is fair disclosure, this is my focus with my company, but clinicians are not trained necessarily to be those administrators or to be the task-oriented or line of business thinking uh, people, and yet they're constantly being asked to switch hats from the clinical role to these other administrative and task-oriented roles. So I think that AI has a potential to bridge for the entire human who is the actual clinician and to provide other supportive layers than just the doing of things. And some of that may be in the thinking through of things. And there's a lot of hope for me, I think, in that light, that we can have AI to support clinicians in their non-clinical work that is actually leading to a lot of burnout by a lot of studies and research that has been shown what incredible weight this is creating on our clinicians.
Fantastic. So next question. As AI transforms healthcare, how can Canada ensure it augments rather than replaces jobs? And what policies will guarantee its conscious, patient-centered use?
Let me jump in with a little bit of I'm a handy guy. So when I'm thinking about tools, we used to cut wood only with saws, right? Manual saws, and then came along the battery operated hand tools. They're just doing its stuff better, but I'm still holding that tool and I'm still cutting that wood, right? So it's the same concept with AI. AI will come in and do things a lot more efficiently, and they'll do a lot better job at eliminating errors and repetitive business, but that doesn't mean that the human element can be removed from the equation. I think it is long before we're going to see AI that is able to work across a broad range, a broad spectrum. So certainly we shouldn't be alarmed by the rise of AI. It's actually a very welcome opportunity, and we need to be reasonable in what we can expect of it. It's still not there. It's still evolving.
Fantastic. Thank you, Attila. With a few minutes left, I'm just going to start with wrapping up. Any questions that were submitted to the Q&A feature that were not answered, we will be looking to get responses and share them with attendees at a later date. But I would like to thank all our presenters for taking the time to speak with us today. I think I speak on behalf of everyone when I say this was a very informative and engaging presentation. So thank you for your time. I'd also like to thank all attendees who joined. And a reminder that we will be sharing the full slide deck as well as a recording on our Insights website at the accumulation of the webinar. So thanks, everybody. I hope you have a great day, and I hope we connect with you all very soon. Thank you.
Thank you.
Thank you. Bye.
Thank you.